All right, well, the City of Johannesburg is launching a 24-hour substance abuse and gender-based violence crisis line. This is part of the city's Women's Month program, which aims to address gender-based violence and femicide. It says that the crisis line will also assist with safety, security, mental health, and access to justice for victims of substance abuse. Let's listen in on that.
Just keep it to your distance, not too close.
Okay. As we start with the program today, I will request that we all stand up and just bow our heads for the souls that we have lost to gender-based violence during this period of COVID-19 and beyond. Can I request that we all stand up and we bow our heads? This is in remembering the souls that we have lost. And as we rise our heads up, can we commemorate this month as the month where we remember all those strong women, the activists, both social and political activists, and those heads of states that joined in the fight against women abuse. As we mark this month of August, we know that this is the month where we celebrate all the activities that actually locate women in their rightful place in society, not only in the kitchen. I will request that we take this time to think about all that we have lost through politics, through activism, through any other means. And I request that after this, we have a little time to reflect and sit down. Thank you. We may be seated. First, I would like to start by requesting that we recognize that gender-based violence and femicide, it is a pandemic in South Africa and even globally. Substance abuse is a serious problem in our country. In the city of Johannesburg, we know the rate of substance abuse, that alcohol is the most used substance. We know that with gender-based violence, that women are being brutally killed, children are being brutally killed and dumped in various spaces. So I will request that as we think about the proceedings of today, that we note that both gender-based violence and substance abuse are also related. I'm going to request the ward councillor, who is councillor for Ward 60, Councillor N.A. Qaba, to come to the fore just to do a welcoming of guests for us and to acknowledge everybody that is here. Ward Councillor Qaba, can you please come to the podium? Ward Councillor Qaba is a councillor for Ward 60, but we are in the presence of Councillor Mnyameni's ward. So Councillor Mnyameni has actually given that opportunity to a woman councillor to come and celebrate this Women's Day and commemorate the Women's Month. Thank you.
Sanbonani, Sanbonani, Dumelang, good afternoon, then Gonke. I'm Nogutula Qaba, the ward councillor in Ward 60. But this is Ward 124, this is the month of the women. When women march to demand for their rights, when one of those women was Rahina Musa, who was highly expectant, but the loving father who loved women and the family, he said to go, my girl, even if you can give birth on the pavement, please go because you're fighting for the good cause. Sanibonani, once more, thank you, Program Director, Honorable Mayor, Councillor Makubu, Honorable MMC for Health and Social Development, Councillor Mqina, Honorable Community MMC for Community Development, Councillor Arnold, heads of departments, public safety, City of Johannesburg managers and directors and their teams, and survivors. You are welcome in this region. This is Region F, hence maybe I was invited to replace women in this in the month of women. What we are here for, at some stage we are fighting, campaigning, doing all the programs, but this is growing by the day. So we need to go back to our drawing boards and say, where do we go wrong? Because from where I am, this is something that we are dealing with, a symptom, not the cause. Because this is a recurrent occurrence, it's happening every day. What is wrong with our society? We are living with a sick society. Therefore, all of us, we are sick, not only women who are abused. Everybody is abused. Take, for instance, a child who will leave a home and just go and decide to go to street. When social workers are attending to those children, they will tell you that it's because of the physical abuse at home. We are a sick society. Whilst I'm welcoming everybody here in Region F, I would say let's go back and start maybe digging further to deal with the scourge. Thank you very much for the MMCs and the mayor and the teams that are here to have this launch today. What will be now? What do we do in order to save our society? Here is the toll number. Let us work with this toll number in order to minimize what we are seeing in our society. Thank you, Program Director.
Thank you, Councillor Kaba. I will then request the MMC for Health and Social Development, Councillor Eunice Mutina, to come to the podium and give us the purpose of us gathering here today. We all know, yes, we are launching the crisis line, but can we give the MMC the opportunity just to give reasons why we are launching the crisis line? Thank you. MMC, over to you.
Thank you very much, Program Director, Mrs. Maswa, Honorable Executive Mayor of the City of Johannesburg, Councillor Mwanda Geoffrey Makubo, MMC of Community Development, Councillor Arnold, the Acting Head of Social Development, Mrs. Bego, the Acting Executive Director of Health, Mr. Desai, honorable guests that are here with us today, the Acting Ward Councillor of Ward 124, Umamkaba, members of the media who are here today with us, the COJ officials who are here with us today, the GBV survivors who have joined us here today, and the men and women in blue who have joined us as well today. Ladies and gentlemen, good afternoon. Executive Mayor, just few minutes ago, myself and MMC Arnold were engaging with different stakeholders in the city on the role of men in this fight against gender-based violence and femicide. And I must say, and MMC Arnolds will attest to that the engagement that we had with them was quite exciting, quite informative, and we hope that if we continue to have such leaders in our society who want to partner with us as government in eradicating this pandemic, as the President would have said, the future looks quite promising for us that will definitely end this pandemic. It gives me a great pleasure this afternoon to be part of this historic moment in the city where today we're launching a crisis line as part of our efforts to combat the scourge of gender-based violence in the city through the city's gender-based violence and femicide crisis line. We saw it fitting to launch this crisis line, Executive Mayor, as part of our Women's Month program, and also to bring hope to the scores of women and children who might be in distress. As the city, we have also elevated tackling gender-based violence as part of our priority programs in the government of local unity, particularly because the President has also highlighted gender-based violence as a second pandemic in the country. In the same scale as the COVID-19 pandemic. We are aware, Executive Mayor, that the attacks on women and children are continuing in the city, more especially during the lockdown period. And this is quite disappointing. Just in the month of June alone, Executive Mayor, about 29 women were killed in and around the city of Johannesburg, and we have embarked on a mission to respond actively to this scourge of gender-based violence. The city already has a substance abuse crisis line, as Rosina would have alluded to, and also saw it fitting to include this gender-based violence, as these are twin efforts. There is a lot of evidence that points to the correlation between substance abuse and gender-based violence. The word Itemba was chosen because we want victims to have hope and not feel hopeless in their situations. Our crisis line is called Itemba, Executive Mayor. The services that are going to be offered includes emotional support for the victims, psychosocial support, mental health support, and access to justice services for the victims. So those will be the services that will be rendered by the crisis line. A question may be asked, why another crisis line? Well, this is a crisis line also forms part of our efforts to complement the work that both the national and provincial government and various NGOs are doing. Until the end of gender-based violence and the killing of women and children, our efforts can never be said to be enough. Executive Mayor, colleagues, we want to relay a message to perpetrators of gender-based violence and femicide that your days are numbered and we are coming after you. Of course, working with different collaborators, different partners, different institution until such time that we have eradicated GBV. There can be no rest. And I wish to urge all citizens of the city to continue to be vigilant, break the silence, help us root out this vigilant, break the silence in all forms of violence against the vulnerable, women and children. I want to say to citizens of Johannesburg, let's use this line as a resource to help us fight the scourge against gender-based violence. Together, as citizens of Johannesburg, working with the city, we can do more. Program Director, thank you very much, and I thank everyone who's here today. Thank you.
That was the MMC for Health and Social Development, MMC Mglina. MMC, we thank you for those words of comfort, those words of support, those words of encouragement, and just locating the city of Joburg within the district service delivery model. My apologies. We are getting used to this new norm. And as we live our daily lives, we forget that we have actually been converted to ninjas, all of us. And next on our program, we have been graced by the presence of two survivors in Joburg. I wouldn't want to call them victims because as a woman, I refuse to be called a victim. As a woman, I will arise to whatever challenge that is brought before me. As a woman, I know that I have been naturally blessed to give birth to the nation. And there is no pain, no torture, nothing that will stop me from reaching my destiny. Be it violence, be it if death do call me, yes, my time would have been come, but I will never allow myself to become a statistic that my value is actually degraded or belittled to a number. I am Rosina Maswa, and all of us here, we've got a name, we've got the wealth that we are bringing. The society is the way it is today. It's actually a reflection of all of us. When you look yourself at the mirror, if you see yourself and you don't see what is happening outside of you, then you start saying to yourself, am I really living? Am I existing for the sake of existing? There is no way that we can stay in such an unhealthy environment that threatens the livelihood of women and children. On that note, I would like to request Sis Mansungoma to join us and share her journey. Can I request a round of applause?
Good afternoon, everybody. Should I stand this side? Okay. Awesome. My name is Ntabi Monsungoma. I thank you so much for giving me an opportunity to speak. Mainly because I have turned my being state of victimized into my strength. I'm just going to share a little bit about my story because I don't have time. And I'll tell you about now what I have embarked on to help women who have gone through or continue to go through what I've experienced. I got married when I was very young. I was 21 years of age. And married to the minister of the Methodist Church. So I was a little Mangfundisi. 3 months in the marriage, I experienced my first dose of abuse. Like any other young girl who gets told when we leave home and be advised on how we should behave, I did exactly that. I was told that you can never ask a man where his whereabouts are. And every time things happen in your household, you must not talk, because the things that happen behind closed doors, they must stay indoors. And the first time he did it, he told me that, and he prepared me. He told me that there will be moments where he will get angry. And when he gets angry, I must understand that men get angry. And when men get angry, they beat up women. And it is what he had experienced in his own household. And I lived in that space for about 8 years. I was working as a young woman, professional in the bank, getting promotions in the ranks there, but at home it was bad. We had children. The last straw was on the 15th of December 2008 when he wanted to kill me in front of our kids. And on that particular day, he had there was an affair that I was aware of. Now, the mother of the girl he was having an affair with was my right-hand woman in church, Vice Mom. And the daughter had an affair with my husband. And the affair was so hot, everybody knew about it. The church knew about it, I didn't know about it. And it happened on this particular day that our daughter was playing, and we had a visitor. He was not happy that the child was disturbing the guest. And he took our daughter and threw her. I just heard the scream of my daughter being held like a chicken, just like that. Just witnessed that. As he was taking the child down the passage, he threw the child against the wall, on top of the bed. And when my daughter tried to come up, he hit her with the fist, and the child started to bleed. And that was the day I decided that enough is enough. I fought back for the first time. And I also beat the hell out of him. And when I left that space, really, it becomes very difficult. And I can tell you right now, it doesn't matter who you are, whether you are a professional or a non-professional. In that space where you're supposed to now leave this toxic space and you are confronted with a family that will not budge in terms of support. And really, I don't understand, but maybe my mother didn't know better either then. Now she understands. But what had happened was that I was told to go back because umshado wami loya. And I refused. As a result, I did not have a place to stay. As a result, I found myself leaving that toxic space with no job, with nothing. And I found myself...
All right, that is that briefing then of the 24-hour helpline, the launch rather, of the 24-hour helpline by the City of Johannesburg. And of course, the question answered there by the MMC, Eunice, the MMC for Health and Safety and Social Development, Eunice Mklina, as to why this crisis line has been launched. And she, of course, referred to the fact that we are living in a sick society and we need to deal with the scourge. And, of course, that the city saw it fitting as part of Women's Month program to bring hope for women in distress.